nurse practitioner student at West Texas A&M University, and I will be performing an advanced health assessment today. We have here a 36-year-old male. We've already completed our history of past medical problems, past surgical problems, allergies, any familial history, and we will be performing a general health evaluation today. So I'm going to begin. We did complete this Nolan exam at this point, which tested cranial nerve number 2, and the patient had positive cranial nerve number 2 was noted. So we're going to begin by evaluating the scalp. I'm just going to first inspect for any bony abnormalities. I'll begin by palpating for any swelling, masses, scaliness of the skin. I'm also looking for any moles. I will be looking for moles throughout this examination, looking for any abnormal, any irregular borders, any large circumference, any discoloration, and any elevation with any moles that I do note. So throughout, I'm going to also be looking for pink skin and scaliness, any redness, erythema throughout the whole entire examination. Now that I'm done with the scalp, I'm going to examine the face. I'm first going to just ask you to remove your glasses for just a moment. I'm going to palpate the sinuses. I'm going to start with the maxillary sinuses and the frontal sinuses. No tenderness is noted on the sinuses. I'm going to assess the transmandibular joint here by having the patient open his mouth. I should be able to fit 2 fingers behind this joint. I'm going to just ask you to move your jaw side to side with your mouth open and close it for me. Great. That does show that we don't feel any clicking or abnormalities with that joint. At this time, I'm also going to palpate the temporal artery, just noting for any thrills. None are noted. I'm going to quickly auscultate just to note any bruits over that temporal artery. And none are noted at this time. I'm going to continue on with my facial exam. I am going to just have the patient smile for me and frown for me and blow his cheeks up for me. Good. That tests positive cranial nerve number 7. I'm going to have the patient open his mouth and say ah for me. And that's testing positive cranial nerve number 10. I'm going to continue on to the eye exam. The eyes are symmetrically placed on the face. I'm not noting any abnormalities with the sclera or the conjunctiva, which is pink. No yellowing or anything in the sclera is noted. So I'm just going to first check for pupillary response. I'm just going to have you look at the wall behind me. This is for direct pupillary response, which is positive, and we're going to have convergence, or accommodation, I'm sorry, which is also positive. We are having good pupillary response, which also indicates cranial nerve number 3. I'm going to have test 3, 4, and 6 at this time by having the patient follow my finger with extraocular eye movement. And we did have good extraocular eye movement at this time. So I'm going to continue on with my ophthalmic exam. I'm going to just find the optic disc and check for red reflex. I'm going to place my hand on his forehead just to help provide support. We are seeing a positive red eye reflex. And the ophthalmic disc is noted. No papillary edema is noted. We're going to continue on with we're going to move on to the nose portion of the exam. The nose is symmetrical. I'm going to have you do patency. I would just like you to cover up one nostril for me and then just blow out. And the other one, please. We are seeing patency of the nose. I'm going to test cranial nerve 1 by having the patient close his eyes, and we're going to see if he can recognize the familiar smell. Do you recognize that smell?
Alcohol.
Okay, great. So cranial nerve 1 is intact. So we're going to move on. I'm just going to quickly examine the inside of the nose, just noting for any polyps or deviation of the septum. This might be a little uncomfortable. Okay. No polyps are noted. I'm sorry. And no deviation of the septum is noted. We're going to continue on to the mouth. I'm just going to look for symmetry of the mouth. The lips are pink, which is to be expected. I'm just going to have you open up your mouth. Great. I'm looking at the buccal mucosa, which is pink and moist. The uvula is midline. At this point, I'm going to test cranial nerve number 10 by performing a gag reflex. And at this point, I'm going to also examine the tonsils. We have a positive gag reflex. The tonsils were small and round. No abnormalities, no erythema was noted. So I'm going to continue on with now moving to the ears. I'm going to just palpate the auricles, noting any masses or swelling, and none were noted. I'm going to examine the tympanic membrane at this time. I'm looking at the ear canal. No redness or erythema is noted, and the tympanic membrane is pearly gray and intact. Also pearly gray and intact. No abnormalities noted in the extra ear canal. We're going to now evaluate cranial nerve number 8 for the ears, and I'm just going to perform a Weber test. I just want you to tell me if you can feel the vibration and sound equally in your ears. Okay, and we're going to perform the Ren test, and I'm going to place this on your bony prominence. Tell me when you can no longer feel it or hear it. Okay, for time purposes, we're going to continue on. I'm going to move for cranial nerve number 5. I'm just going to have the patient tell me if what he feels on his face is sharp or dull using a cotton tip applicator. You could just close your eyes for me.
Sharp. Dull.
Okay. We do have positive cranial nerve number 5. We're going to continue on from the ear exam into the neck. I'm going to palpate the carotid artery, which is brisk, +2. I'm going to palpate the thyroid gland. I'm just going to have you swallow for me. Great. The thyroid gland was palpated, and it was smooth and soft and mobile. That also tests cranial nerve number 9 and 10 as well with this swallowing motion. I'm going to test cranial nerve number 12. Just going to have you push up against my arms. Great. We're going to also check range of motion and strength of the neck. So I'm just going to have you push up against my hand for me. And again. Great. And range of motion, I just want you to look over your shoulder and over your shoulder again. We're going to perform extension and flexion of the neck. Great. Okay, I'm looking at the trachea now. The trachea is midline. No abnormalities, no increased work of breathing is noted at this time. So we're going to continue on to the posterior chest. I'm just going to have the patient turn around so that we can expose your back, please. If you can just sit on the other side of the bed, that would be great. Okay, we're going to first check for excursion of the lungs. I'm going to just place my hands here and just have him take a big, deep breath and watch my thumb symmetrically move and let it out. Great. I'm going to continue on with tactile firmness. So what I'm going to have him do is repeat 99 as I feel along his chest.
99, 99, 99, 99, 99.
Great. We're seeing good, positive. No abnormalities noted there. I'm going to do diaphragmatic excursion. So what I'm going to have you do is just take a deep breath as I percuss along your back and hold it for me. Okay. Okay, now release. Okay, diaphragmatic excursion is rated about 3 centimeters, which is normal for this patient. I'm going to now listen for breath sounds on the posterior. Just take some big deep breaths for me. Good. Ta-da. Just moving down in the systematic manner. I'm not noting any adventitious breath sounds at this time. No crackles, no wheezes, and no signs of consolidation are noted throughout the lung fields. We're seeing vesicular lung sounds at the bottom basis, which is what is to be expected. I'm going to perform echophony, brochophony, and whisper perctuliquy at this time, so I'm just going to have the patient say the letter E as I listen now.
E, 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 E.
Now I'm going to have you say 99.
99, 99.
We are hearing muffled sounds, which is what is to be expected through this examination.
99.
And I'm going to have you whisper 99. We're not hearing any adventitious sounds. Which is what is to be expected, no increase in the vocal. I'm going to continue on with my percussion. I'm going to move down in a ladder-like manner, noting resonance throughout all lung fields, which is the expected result. No dullness is noted throughout. I'm going to check for CVA tenderness while looking at the back. Can you tell me if that hurts? Okay, great. So what I'm going to have you do now is just return to the front of the bed and we're going to look at the anterior chest. Great, thank you. If you could just expose your chest for me, great. I'm going to first just inspect. At this time, I'm also going to inspect the male breasts. For female breasts, I would do a more thorough exam, which would just perform a lawn mowing-like motion for palpation. But for males, it's just necessary to palpate the axillary lymph nodes and note for any asymmetry masses noted to the chest wall, which are not noted. I'm now just going to have you take some big deep breaths while I feel along the lung fields. We're also noting the heart while we do this, just feeling for any thrills or heaves that might be noted. Okay, that's good. I'm going to continue on by just listening to the breath sounds. Just take a big deep breath for me. Great. I'm not noting any adventitious breath sounds, no crackles, no wheezes are noted. I'm also going to check the anterior lung fields, which also are free from any adventitious breath sounds at this time. So those are good things. Okay, I'm going to just continue on with percussion now of the chest, working down just in the same manner as the back in a ladder-like motion. I'm not noting any dullness. I am noting resonance throughout the entire chest. So now that we've finished with our lung exam, I'm going to move on to the cardiac exam. I've already palpated over the second intercostal right of the sternal border, over the left of the sternal border, third and fourth intercostal space left of the sternal border, and over the mid-clavicular line, fifth intercostal space. At this point, I will also note the point of maximum impact, which for this patient is easily found just based on his body habitus. It is noting to be about 2 centimeters, which is an expected result. And I'm not noting any thrills or heaves at this time while feeling on the chest. I am now just going to listen. I'm going to listen for any murmurs, and hopefully we'll hear good S1 and S2. I'm first going to listen over the aortic part of the chest with the diaphragm of my stethoscope, over the second intercostal space, right of the sternal border, left of the sternal border, listening to the pulmonic area of the chest, third and fourth intercostal space, left of the sternal border, listening for the tricuspid, and at the apex of the heart, mid-sternal border, fifth intercostal space. No thrills, no murmurs are noted, and normal S1 and S2 are noted. I'm just going to have the patient lean forward at this time. This will help in identifying any aortic regurgitation, so I'm just going to briefly listen. I'm also going to listen with the bell with the patient in this position. with my stethoscope, that just means that I'll be putting less pressure with the stethoscope because I have a cardiology stethoscope. Over the tricuspid, the last was the mitral, pulmonic, and aortic areas of the heart. And normal S1 and S2 were noted throughout, which is an expected result. So we're going to continue on. At this point, I'm going to measure jugular venous pressure. So I'm going to just elevate the head of the bed to 30 degrees and just have the patient lay down. I'm going to look for the point of maximum oscillation in the jugular vein and measure that with the sternum border. If you could just look all the way to the side, perfect. Okay. Just going to expose. And we're noting it about 3 centimeters, which is an expected result. Okay, and at this point, I'm going to continue on through my examination. I'm just going to expose your stomach because we're going to continue on to the abdomen portion of the exam, okay? First, I'm going to just inspect for any areas of hernias that could be noted, any masses, any swelling. I'm going to move to the side of it. I'm going to now just look for the aortic valve, which is midline and about 2 centimeters. I'm going to palpate for the femoral artery here on both sides. And it is normal. We're not noting any thrills or anything like that nature. I'm going to grab my stethoscope and perform auscultation of the abdomen. And tympany is noted throughout the abdomen. Normal bowel sounds, I'm sorry. Okay, normal bowel sounds are noted throughout the abdomen. So now I'm going to move on to percussion. I'm just going to start in the right lower quadrant. Tympany is noted at this point. I am noting some dullness over the right upper quadrant, which is where the liver is located. So what I'm going to do is measure the liver span at this time. So I'm going to start with the umbilicus, mid-clavicular line, and work my way up till the area of dullness is noted and marking that. And then I'm going to start at the nipple line, mid-clavicular line, going downwards. Dullness is noted, and the liver span's about 6 centimeters, which is an expected result. I'm going to continue on with my percussion. I'm not noting any dullness over the spleen, which is an expected result. Okay. I'm going to move on to palpation of the abdomen. I'm going to start with light palpation, just noting any masses or swelling that could be seen at this time. I'm now going to perform deep palpation, so I'll be looking for the liver sternal border, or the inferior border. So I'm just going to have you take a big deep breath and then let it out, and I'm going to perform the hook test, providing pressure in the back. I am palpating the liver at this time, and it is a smooth border, about 1 centimeter below the costal margin, which is an expected result. I'm going to palpate for the spleen at this time, providing that same downward pressure in the back. And the spleen is not palpable. I'm going to look to see if I could palpate the kidneys at this time. And they are also unpalpable, which is an expected result. I'm going to now continue on from the abdomen. We're going to move into the genitalia. For a male, what I would do for the male genitalia exam is I would palpate first the scrotum, just feeling for any masses or looking for any lesions. Also the spermatic cord. I would also look at the glans penis, just noting any lesions or masses, and the meatus, and the shaft of the penis, noting the same things. For a woman during this part of the exam, I would first just examine the external genitalia, looking at the labia, the clitoris, noting for any swelling of the glands, and then I would also perform a bimanual exam. That would just be for noting the size and consistency of the uterus, and then I would perform a pelvic exam and get a pap smear result that could be sent to lab, which is an important part of all examinations. So now that I've completed this portion of the exam, I'm going to move on to the musculoskeletal portion of the exam. So I'm just going to lay the patient completely flat. I'm just going to have you flex the knee, flex the knee, extend the knee, abduct the knee, or the hip, I'm sorry, and abduct the hip. We're going to do internal rotation of the hip and external rotation of the hip, and everything is noted to be normal at this time. Also, I forgot to mention, but during the male genitalia exam, I would also just note for any areas of herniation. I'm going to move to the knees now. So what I'm going to have the patient do is we're going to flex and extend, internally rotate, and externally rotate. Okay, great. We're going to move to the ankles. I'm going to just have you dorsal flex. I'm going to also check strength this time, so I'm just going to have you resist my hands, and we're going to perform plantar or dorsal flexion. Okay, and now I'm going to have you perform plantar flexion. Just try to completely extend your feet. Great, and we're going to see if we move evenly this way and that way. Great. Also at this time, I'm just noting capillary refill of the feet, noting skin color, texture, so that's all normal as well. I'm going to just have the patient sit up at this time, and we're going to continue on to the upper extremities. You can just swing your legs around. Earlier I didn't examine the lymph nodes of the neck, so I'm just going to continue with that real fast before we continue on with the shoulder examination. So I'm going to do the pre-auricle lymph nodes, post-auricle lymph nodes, occipital, submaxillary, submandibular, tonsillary, deep cervical chain, and posterior cervical chain, and posterior clavicular. And all the lymph nodes were noted normally, okay? I'm going to now continue on with the range of motion. We're going to start with the shoulders. I'm just going to have you completely place them out behind you. Great. And we're going to lift them up over your head and down below your sides. Great. We're going to abduct and adduct the shoulders. Great. We're going to internally rotate, and we're going to externally rotate. Great. Full range of motion is noted in the shoulders. I'm going to now continue on to the elbows, and at this time I can also check strength. So I'm just going to have you put your like this and just try to push up against my hands. Great, and down. Okay, and we're going to completely extend and flex. Great. Now we're going to move on to the wrists. We're going to have you just extend and flex and abduct. Great. We're going to check fingers at this time. I'm going to just have you do grip strength first. This checks for cerebral function as well. If you could just squeeze as hard as you can, great. We're going to abduct the fingers and adduct the fingers as well. Great. Now that we're on the palms, we're going to do number identification. So I'm just going to have the patient close his eyes. This will test cerebral function as well. So I'm going to write some numbers on your hand.
1, 8.
Great. So he does have positive cerebral function. What I'm going to have you do now is quickly move your hands from side to side. This will test range of motion of the wrists as well as cerebral function. You can just do it real fast. Okay, great. Good job. Okay, we're going to also just do point to point. So I'm just going to have you place your hands out. I'm going to press each finger, and I just want you to close your eyes and touch your nose during this portion of the exam. Great. Perfect. Okay. Great job. We're also going to do point to point on the leg. So I'm just going to have you take your heel of your one foot and place it on your knee and just run it down your shin. And perfect. Great cerebral function is noted at this time. So we're going to continue now. I'm going to just palpate the pulses. We're going to do brachial pulses. We already did carotid and temporal. We're going to do radial. Great, we already did femoral. We're going to do popliteal and dorsus medialis and posterior tibia. And pulses are all +2, which is an expected result. I'm now going to check for reflexes. I'm going to start by doing the tricep reflex. Great. And we're going to do the bicep reflex. You can just relax your arm. And we're going to do the radial also. I'm I'm just gonna have you cross your legs and we're going to do the knee at this time. This just helps the patient relax, great. And we're going to do the Achilles as well. We're seeing positive reflexes, which is an expected result. Now I'm going to have the patient stand up. We're going to check full range of motion of the back. So I'm just going to have you completely extend, and we're going to flex by just having you touch your toes. If you could do that for me, great. We're seeing good range of motion of the spine. We're going to do lateral bending and rotation. Okay, great. And I'm now going to examine more cerebral function. I'm going to watch gait. So I just want you to start from here and just work your way over, just walking in front of me so that I can visualize. No abnormalities noted with the gait. Now I'm going to have the patient do heel to toe walking on the way back to me. I'm sorry. Heel to toe walking. Great. Good job. And then we're going to now walk on our heels back towards the door for me, please. And then turn around and we'll walk back on our toes. Great. We're going to also perform the Romberg exam at this time. So I'm just going to have the patient close his eyes and we're just going to check for any movement or clumsiness, anything of that nature. And we're not noting any, so that shows positive cerebral function. And I believe that covers everything for our physical examination today. Thank you so much.